Which component in blood is primarily responsible for maintaining osmotic pressure within blood vessels? A. Hemoglobin. B. Albumin. C. Glucose. D. Red blood cells. The correct answer is B. Albumin is a major plasma protein that helps maintain osmotic pressure, preventing fluid from leaking out of blood vessels into surrounding tissues. Which precursor cell is most directly responsible for the formation of erythrocytes in the process of hematopoiesis? A. Lymphoblast. B. Proerythroblast. C. Myeloblast. D. Monoblast. The correct answer is B. The proerythroblast is an early cell in the erythropoietic lineage that eventually develops into a mature red blood cell. What is the primary site of erythropoietin, EPO, production in adults? A. Liver. B. Bone marrow. C. Kidneys. D. Spleen. The correct answer is C. In adults, the kidneys are the main producers of erythropoietin, a hormone that stimulates red blood cell production. Which form of anemia is caused by an autoimmune response against intrinsic factor in the stomach? A. Iron deficiency anemia. B. Sickle cell anemia. C. Pernicious anemia. D. Aplastic anemia. The correct answer is C. Pernicious anemia results from a deficiency in intrinsic factor, which is necessary for the absorption of vitamin B12. Which ion plays a critical role in the coagulation cascade by acting as a cofactor in several clotting steps? A. Sodium. B. Calcium. C. Potassium. D. Magnesium. The correct answer is B. Calcium ions are essential cofactors in multiple steps of the coagulation cascade, helping to stabilize and activate clotting factors. What is the average lifespan of a red blood cell in circulation? A. 15 days. B. 30 days. C. 120 days. D. 200 days. The correct answer is C. Red blood cells typically circulate for around 120 days before being phagocytosed in the spleen or liver. The majority of carbon dioxide in the blood is transported in which form? A. Dissolved. B. Carbaminohemoglobin. C. Bicarbonate ions. D. Carbonic acid. The correct answer is C. Most carbon dioxide is converted to bicarbonate ions in red blood cells before being transported in the plasma. What type of stem cell gives rise to all blood cell types? A. Myeloid stem cell. B. Lymphoid stem cell. C. Hemocytoblast. D. Erythroblast. The correct answer is C. Hemocytoblasts, or hematopoietic stem cells, are pluripotent cells in the bone marrow that can differentiate into all types of blood cells. Which type of anemia is associated with a genetic mutation affecting the structure of hemoglobin? A. Aplastic anemia. B. Iron deficiency anemia. C. Sickle cell anemia. D. Pernicious anemia. The correct answer is C. Sickle cell anemia is caused by a mutation in the hemoglobin gene, leading to abnormal, crescent-shaped red blood cells. Which plasma protein is most abundant and plays a key role in maintaining blood pressure and volume? A. Fibrinogen. B. Albumin. C. Globulin. D. Prothrombin. The correct answer is B. Albumin is the most abundant plasma protein and helps maintain osmotic pressure, blood pressure, and fluid balance. Which organ is primarily responsible for filtering out old or damaged red blood cells from circulation? A. Liver. B. Spleen. C. Kidneys. D. Lungs. The correct answer is B. The spleen acts as a filter, removing old or damaged red blood cells and recycling their components. The hematocrit is a measure of which component of blood? A. Plasma volume. B. White blood cell count. C. Percentage of red blood cells. D. Platelet count. The correct answer is C. Hematocrit is the percentage of blood volume occupied by red blood cells, a key indicator of oxygen carrying capacity. Which of the following factors directly stimulates red blood cell production in the bone marrow? A. Calcitonin. B. Erythropoietin. C. Thyroxine. D. Insulin. The correct answer is B. Erythropoietin, primarily produced by the kidneys, stimulates the production of red blood cells in response to low oxygen levels. A deficiency in which of the following vitamins could lead to an increased risk of bleeding due to its role in clotting factor synthesis? A. Vitamin C. B. Vitamin D. C. Vitamin K. D. Vitamin. The correct answer is C. Vitamin K is essential for synthesizing clotting factors, and its deficiency can lead to increased bleeding risk. Which protein in blood plasma is primarily responsible for blood clotting? A. Albumin. B. Globulin. C. Fibrinogen. D. Myoglobin. The correct answer is C. Fibrinogen is a plasma protein that is converted into fibrin during the clotting process, forming a blood clot. During erythropoiesis, at which stage does the developing red blood cell lose its nucleus? A. Proerythroblast. B. Erythroblast. C. Reticulocyte. D. Erythrocyte. The correct answer is C. Reticulocytes are immature red blood cells that have expelled their nucleus before fully maturing into erythrocytes. Which blood disorder is characterized by an overproduction of immature white blood cells that disrupts normal blood cell production? A. Leukemia. B. Thalassemia. C. Hemophilia. D. Polycythemia vera. The correct answer is A. Leukemia is a type of cancer that causes an overproduction of immature white blood cells, impairing the production of normal blood cells. Which blood type is known as the universal donor due to its compatibility with all blood types in transfusions? A. Type A. B. Type B. C. Type AB. D. Type O. The correct answer is D. Type O blood lacks A and B antigens, making it universally compatible for recipients with any blood type in emergency transfusions. In the context of blood groups, what does the Rh factor refer to? A. Presence or absence of antigen D on red blood cells. B. Presence of specific antibodies in the plasma. C. The coagulation property of blood. D. The ion binding capacity of hemoglobin. The correct answer is A. The Rh factor refers to the presence or absence of antigen D on the surface of red blood cells, classifying blood as either Rh positive or Rh negative. Which of the following blood tests measures the percentage of red blood cells to total blood volume and is commonly used to diagnose anemia? A. Hemoglobin test. B. Complete blood count, CBC. C. Hematocrit. D. Coagulation test. The correct answer is C. The hematocrit test measures the proportion of red blood cells in blood and is a key diagnostic test for anemia and other conditions. What type of blood cell is primarily responsible for phagocytosis in the immune system? A. Erythrocytes. B. Platelets. C. Neutrophils. D. Lymphocytes. The correct answer is C. Neutrophils are a type of white blood cell that performs phagocytosis, engulfing and destroying pathogens to protect the body from infection. Which organ releases thrombopoietin, a hormone that regulates platelet production in the bone marrow? A. Liver. B. Kidneys. C. Spleen. D. Lungs. The correct answer is A. Thrombopoietin, produced primarily by the liver, stimulates the production of platelets in the bone marrow. Which molecule on the surface of red blood cells determines an individual's blood group? A. Hemoglobin. B. Antigen. C. Antibody. D. Erythropoietin. The correct answer is B. Blood group is determined by the presence or absence of specific antigens on the surface of red blood cells, such as A, B, and Rh antigens. Which of the following conditions is associated with a deficiency in factor VIII, leading to excessive bleeding? A. Hemophilia A. B. Hemophilia B. C. Von Willebrand disease. D. Thrombocytopenia. The correct answer is A. Hemophilia A is caused by a deficiency in clotting factor VIII, leading to impaired clotting and excessive bleeding. Which is the primary clotting factor that gets converted into fibrin, forming the stable mesh of a blood clot? A. Prothrombin. B. Fibrinogen. C. Factor X. D. Factor VIII. The correct answer is B. Fibrinogen is converted into fibrin during the clotting process, which forms the mesh that stabilizes a blood clot. Aplastic anemia is caused by the failure of which organ to produce adequate blood cells? A. Liver. B. Spleen. C. Bone marrow. D. Kidneys. The correct answer is C. Aplastic anemia occurs when the bone marrow fails to produce enough red blood cells, white blood cells, and platelets. Which type of white blood cell increases in response to an allergic reaction or parasitic infection? A. Neutrophils. B. Eosinophils. C. Basophils. D. Lymphocytes. The correct answer is B. Eosinophils increase during allergic reactions and parasitic infections as part of the body's immune response. The Bohr effect, which enhances oxygen delivery to tissues, occurs under which of the following conditions? A. High oxygen levels. B. Low carbon dioxide levels. C. Increased acidity and carbon dioxide. D. Low temperature. The correct answer is C. The Bohr effect describes how increased acidity and carbon dioxide reduce hemoglobin's affinity for oxygen, enhancing oxygen release in tissues. What type of anemia results from chronic blood loss and is often associated with iron deficiency? A. Hemolytic anemia. B. Megaloblastic anemia. C. Pernicious anemia. D. Iron deficiency anemia. The correct answer is D. Iron deficiency anemia can result from chronic blood loss, where the body's iron stores are depleted, impacting hemoglobin production. Which of the following is a characteristic feature of macrocytic anemia? A. Small red blood cells. B. Large red blood cells. C. Low white blood cell count. D. Increased platelet count. The correct answer is B. Macrocytic anemia is characterized by larger than normal red blood cells, often due to vitamin or folate deficiency. In the blood coagulation cascade, thrombin directly acts on which of the following proteins to form a clot? A. Prothrombin. B. Factor X. C. Fibrinogen. D. Calcium. The correct answer is C. Thrombin converts fibrinogen to fibrin, which forms a mesh-like structure to stabilize the blood clot. Which cell type is primarily involved in the production of antibodies in the immune system? A. Neutrophils. B. T cells. C. B cells. D. Monocytes. The correct answer is C. B cells are white blood cells that mature into plasma cells and produce antibodies in response to pathogens. Which part of the hemoglobin molecule binds directly to oxygen? A. Globin chains. B. Iron in heme. C. Protoporphyrin ring. D. Histidine residues. The correct answer is B. The iron atom in the heme group of hemoglobin binds to oxygen, allowing oxygen transport in the blood. Which of the following conditions occurs due to a deficiency of vitamin or folic acid, leading to defective DNA synthesis in red blood cell precursors? A. Hemolytic anemia. B. Sickle cell anemia. C. Megaloblastic anemia. D. Pernicious anemia. The correct answer is C. Megaloblastic anemia occurs when vitamin or folic acid deficiency disrupts DNA synthesis, causing large, immature red blood cells. The breakdown of hemoglobin produces bilirubin, which is then processed by which organ before being excreted? A. Kidneys. B. Spleen. C. Liver. D. Intestines. The correct answer is C. Bilirubin is processed by the liver after being produced from hemoglobin breakdown in the spleen, before it is excreted in bile.